Happy Friday, everyone, and welcome to another episode of Rhode Island Latino News Opinion Plus. This is a space for our opinions where we talk about current events and questions the Latino community is curious about. My name is Belen Dumont, reporter and editor for Rhode Island Latino News, and today we are joined by Stephanie Geller, Deputy Director of Rhode Island Kids Count. The nonprofit organization has been advocating for children across Rhode Island since its founding in 1994. Welcome, Stephanie. It's a pleasure to have you.
Thank you. It's wonderful to be here.
So I'm excited for our conversation. I was hoping you could just start off by telling us about Rhode Island Kids Count. I'd love to hear about its mission and your ongoing work.
Sure. So the mission of Rhode Island Kids Count is really to improve the health, safety, education, economic well-being, and development of all of Rhode Island's children with a commitment to equity and the elimination of unacceptable disparities by race, ethnicity, disability, zip code, immigration status, neighborhood, and income. We've been, as you said, been around since 1994. We have actually a big change happening here at Rhode Island Kids Count. Our founding director, Elizabeth Burke Bryant, is stepping down after nearly 30 years with us. And our new executive director, Paige Clashes-Parks, will be joining us in December. So I wanted to share that news with your listeners.
That must be exciting. Yeah, a big change.
Yes. And other things I wanted to share with you are, in addition to that being our mission, other things that are really important to the way we do our work are we really try to amplify youth voice so youth can be really leaders in issues that affect them, and to incorporate the voices of those with lived experiences who are closest to the issues so that the policies we work to change really come from those who are most affected.
That's really amazing. Yeah, I think that's something we've learned over time where experience really is another type of knowledge. It's not really something you learn in academic settings, but your own life. Well, I guess I can transition then to our first topic, which is about youth homelessness, since November is a National Youth Homelessness Awareness Month. I was hoping we could talk about the growing number of children and youth experiencing homelessness across Rhode Island. And in your experience and opinion, what factors might be causing this within Rhode Island specifically?
So I guess we've been having an affordable housing crisis in Rhode Island well before the COVID-19 pandemic, but the pandemic really only made things worse. As you said, this month we're really celebrating the National Homeless Children and Youth Awareness Month. So it's an opportunity to raise awareness about the issue of homelessness being experienced by children and families, youth and young adults throughout Rhode Island and across the country. The most recent data we have is for 2021, when 242 Rhode Island families with 508 children stayed at emergency shelters, domestic violence shelters, or transitional housing programs. I also just this morning pulled up some of the even more recent data that the Rhode Island Coalition to End Homelessness includes on their website on a weekly basis. And as of November 3rd, there were 1,339 people in Rhode Island who were homeless, including 213 families who are awaiting a place in a shelter, and 507 people who are sleeping outside, a particularly worrisome statistic as the weather gets colder. I know I've seen frost on the ground for the first couple of times this week, and I have a lot of concern for people who are trying to survive outside in their cars or in tents or in other places where people are not meant to be living, especially if they're with children.
Right, especially. What types of resources and services then might these children, youths, and families really benefit from?
One of the resources I think is really important is that our state has what we call a coordinated entry system, and there's a helpline that people can call if they're in need of shelter or need to get access to affordable housing. We'll include that link with the information later, but that number is 401-277-4316. And people can call if they're at risk of being evicted, if they're living in an unsafe situation. And the people on the other end of the line can help them connect with the shelter, apply for affordable housing opportunities, or try to help them brainstorm other immediate solutions to their crisis.
Thank you. I appreciate that. Those are really important resources. My next question was really how residents can get involved in supporting these family and children in their communities. I imagine it can be hard sometimes to reach out for help and to find these resources. So maybe having sort of discussions can really be one factor, but I'm not sure what you think.
So do you mean specifically around housing and homelessness, or more generally?
I guess, yeah, it could be both.
Yeah, so there certainly are opportunities to sort of to get involved. There have been a lot of public hearings recently about the need for more shelters. I live in Cranston, and there was recently um, a hearing at the Cranston City Council about efforts to put temporary shelters across the state to house people during the winter, and some concerns that residents had about having those temporary shelters in their communities. Um, and I know that that people want to really do want to help their neighbors, and I would encourage people to reach out and voice their interest in making sure that the state and their communities do what needs to be done to make sure that people, and particularly children and families, are safe all the time, but particularly as winter approaches. We don't want anybody to freeze. We want to make sure people are safe, and we want them to be connected to opportunities for long-term affordable housing. So we want to make sure they get the help that they need immediately to be in a shelter, if that's with appropriate places. And then we want to help them apply for affordable housing opportunities so they can be in a permanent house, which is really the right place for all kids to be, so that they can be physically healthy, mentally healthy, have good development, and have good educational achievement. We know that kids who are homeless um, are more likely to be sick, more likely to be hungry, and less likely to do well in school. So we need to get children and families those resources so they can have a permanent place for kids to be, so that they can develop, learn, grow, and be a member of their family like all of us.
Thank you. That was such a great explanation. I appreciate that. Um, so, I guess switching topics a little bit, across New England, children are also experiencing a mental health crisis, and Rhode Island is not an exception, unfortunately. Last April, Rhode Island was declared to be in a state of emergency in child and adolescent mental health. And in that statement, Rhode Island healthcare officials they gave recommendations to address the situation. I was wondering, what are some of these key steps that Rhode Island might need to take to address this crisis?
Sure. Well, one of the things that Rhode Island Kids Count really does is we release a number of reports with a lot of important data, because we like people to make decisions that are based in data, so that they really understand the extent of the problem, as well as have information on best practices, both from within Rhode Island and from across the country, of how to address the issue. So we recently released a policy brief on the children's mental health crisis just a couple of weeks ago. And one of the startling statistics was really the increase in the number of high school students who report that they've been sad or hopeless for more than 2 weeks over the past year. So that was more than a third, or 37.8% of high school students reported that statistic. And we're also seeing disturbing data that about 1 in 10 high school students report that they've attempted suicide in the past year. Again, something we're very concerned about. So we've been trying to really raise the alarm about the mental health crisis among children, and particularly among poor children, children of color, and also children who are in the LGBTQ plus community, who are particularly affected by mental health crises. And so we included data about the crisis in the mental health brief, but we also included a series of recommendations. Some of those recommendations I would want to highlight are really to focus on earlier. So really to address prevention and promotion at the very beginning. So rather than thinking about mental health as being a problem, think about mental health as being what we all want to achieve. We want to be mentally healthy. So we need to really create situations in our homes, schools, communities for kids to be mentally healthy. That includes providing economic and community supports to children and families, so that families have the economic supports that they need, that they get childcare, access to help that they need in their community. It also involves making sure that schools are places where kids can turn for help. So we know that many children, their first interaction with mental health providers is really talking to a school psychologist or a social worker or a school counselor in their school, but there's really a lack of there isn't enough, aren't enough of those providers in our schools. So we've been trying to raise awareness about that issue and try to find permanent and sustainable sources of funding so we can get more school-based mental health professionals in our schools. Another strategy is really to reach out to pediatricians, because that's another often an early entry point for families when they identify that a child is depressed or anxious or having other mental health issues. They often first turn to their pediatrician, or someone they trust. So giving pediatricians information and resources so that they can help the children that they serve is another important thing we need to do. And finally, I wanted to highlight the need to really address the workforce crisis, because we're seeing long waiting lists for a lot of different social services, including mental health, because we don't have enough mental health providers, because we're not adequately paying them. Paying them as individuals, our health insurance companies and Medicaid providers are not providing adequate fees. And so we need to really look at those fees and make sure that we provide adequate payment so that we can have access to these important providers in our communities.
Those are amazing recommendations. You're really looking at all of this as a whole and really how it's going to affect one thing at a time. I was
Absolutely. Yeah, we know that we want kids to be able to get the mental health care that they need at the right time and in the right place. So it's not any one person or system that can serve. We really need to really look to families, look to communities, look to doctors' offices, and look to schools, and really solve the problem altogether.
right, because they have the support system, but the support system needs strengthening within itself. Um,
Absolutely.
and I appreciate that emphasis on prevention at starting at a very early time, because what we're looking at is the consequences of areas that are lacking support. Um, were these recommendations just made in October or were they made earlier?
So we just released our policy brief just a couple of weeks ago. Some of those recommendations were drawn from the recommendations that you spoke about that came from the groups that declared a mental health emergency, and others from other sources. And you can access all of our publications, including the mental health brief, on our website at www.rikidscount.org.
Thank you. Yeah, we'll definitely include all those links. Um, oh, we're running out of time already, so I'm going to jump to another one. Well, I guess this is still relating. This is actually the report specifically you were talking about, more on the youth of color, how they are disproportionately affected. They're more likely to have their mental health impacted by the pandemic, and they're a lot less likely to receive mental health treatment. I was wondering if you could explain maybe more specifically of the less likely to receive mental health treatment. I think there's some barriers that really need to be explored.
Yeah, one barrier is that there's a lack of culturally competent and linguistically competent providers. So we need to provide access points for more diverse mental health providers to enter the field, and for us to provide mental health providers that speak all languages that children and families need access to. We also know that in some cultures it's less acceptable to talk about mental health, and so we need to really reduce barriers and the stigma associated with mental health, and make it, like I said, if mental health is something we're trying to achieve, then it's not something bad we need to be worried about. It's just something we're all working on, all the time. We're all trying to be as mentally healthy as we can. And when people need help achieving that goal, we should offer it to them without any stigma attached and without any access barriers.
Absolutely. Um, I guess relating to that, there has been in general an increase in the Hispanic and Latino population. Between 2000 and 2010, this is all from your website, by the way, Rhode Island's Hispanic child population grew by 31%. I was really shocked, specifically the children population has been growing higher. In what ways, in your opinion, does it need to really support these families?
Yeah, so it is really important to note that our community is becoming much more diverse, and almost the entire increase in our child population is represented by increases in the number of Latino children. So, and our child population is much more diverse than our adult population. So in 2020, 27% of our children were Latino and 14% of adults. So you can see much bigger population. And the younger the kids are, the more likely they are to be from diverse cultural backgrounds. So children under the age of 5 are much likely to be Latino, Asian, Native American, Black than our older population, which tends to be more white in Rhode Island and across the country. And we really need to look at diversity as an asset, and not, but we also need to be aware of the disparities we see in children's economic well-being, educational outcomes, et cetera, by race, ethnicity. Really be honest about the reasons for those disparities and then try to tackle them. Some things I think are particularly important for the Latino population is really working on trying to provide more support for multilingual learners, for those who are new to this country and still learning English so that they can succeed. We see much lower rates of high school graduation, much lower rates on the different standardized tests for multilingual learners than we do for primary English speakers. We also need to look at access to college, because we know how much more people earn when they have a bachelor's degree than if they have just a high school diploma, and they're much more likely to be employed. So we need to really look at our state's Rhode Island Promise Scholarship Program and open it up and improve it by providing more access to four-year college. That's where we see the biggest gaps. So for example, only 23% of Latino students in the class of 2021 went directly to college, compared to 46% of white students. So we really need to think about giving people the financial opportunities, giving them the guidance counsel that they need, and providing them the support if they're learning English throughout the school system so that they can succeed, because we know education is a primary way out of poverty for many families.
Right. Thank you for that answer. We're out of time, but is there anything else you would like to share with our audience before we go? Any reminders, resources? We'll also have all of this and the web doc more attached.
Sure. I guess I just want to again encourage people to look at our website at www.rikidscount.org for more information. Follow us on social media. In addition to posting our publications, we also put up opportunities to testify, because we know that the voices of the people who are affected by these policies are really important. So if young people, parents, community members want to come out and testify at the State House, at regulatory hearings about issues that they care about, we do try to put up information about those opportunities and give people the support that they need to testify on their own behalf.
Thank you so much. We appreciate you having me. It's been a pleasure talking to you. We hope to see you again.
Thank you. I appreciate the opportunity to be on. Have a great day.
So, everyone, please join us next time on Rhode Island Opinion Plus. This is a space for our opinions where we talk about current events and questions the Latino community is curious about. So for more information about our discussion today, please check out the web story on RhodeIslandLatinoNews.com and follow us on Twitter at Rhode Island Latino News. I'm Belen Dumont with the Rhode Island Latino News Opinion Plus, and I will see you all next time.